What can happen when you bump your head? This is the brain. It sits in the skull, floating freely in fluid. When an impact is sustained to the head, the brain hits the skull and gets damaged. This is called a concussion. Scary, right? Well, depending on the severity of the injury, many one-time traumatic brain injury patients can actually make a full recovery. However, many people aren't aware of a much more life-threatening disease that can arise 10, 20, even 30 years after the initial brain damage. Chronic Traumatic Encephalopathy, or CTE, is a neurodegenerative disease caused by concussions or even multiple seemingly benign subconcussive impacts, and it can happen to anyone with a history of head trauma. Discovered recently in 2002 by Dr. Bennett Amali, not only is CTE currently incurable, but it is also undetectable on brain scans and many other current testing methods, making it nearly impossible to diagnose until a post-mortem autopsy. In fact, many cases go undiagnosed or are misdiagnosed for other conditions like Alzheimer's, depression, or dementia. CTE occurs after enough trauma to the head when the structure of the brain is compromised. A protein called tau spreads and creates neurofibrillary tangles that block signals between neurons, causing brain function to deteriorate over a span of 5 to 10 years. At stage 1, small pockets of tau are present in the frontal lobe. Patients may only have minor symptoms that can go largely unnoticed, like headaches or forgetfulness. At stage 2, the tau spreads further into the frontal lobe, and many patients experience noticeable impairment to memory, mood swings, and extreme behaviors. Stage 3 is when the tau spreads much further into the frontal and temporal lobes, leading to significant memory loss and a general lack of cognitive, emotional, and behavioral control. Imagine that your memory fails, feeling confused, often repeating words and phrases, feelings of depression and anxiety building up. Stage 4 is the most progressed stage of CTE. The tau has spread throughout the brain to kill many of the nerve cells. All previous symptoms progress dramatically. Language and motor difficulties come into play, and patients have trouble remembering even the basic things. Over time, these symptoms can create a sense of insanity, causing such severe psychological issues that one of the leading causes of death in CTE patients is suicide. Although there is no known cure, there are active studies being done, and treatments for the symptoms, like cognitive exercises, psychological therapy, experimental medicine, all combined with a healthy lifestyle. Chances are that if you're watching this video, either you or someone you know has had a concussion or brain injury. So let's share this information, do everything we can to protect our heads, and together, we can step into a safer headspace.